What questions or problems are you working to solve?
Thank you, Rola, for having me. It's a pleasure to be here. So change is inevitable. And as a clinician and a researcher, I believe that we have to run towards change to effectively adapt our method of patient care delivery, ultimately to do what's in the best interest of our patients, right? So something that I've spent a lot of my time in my career focusing on is the advancement of virtual patient care and its impact on economic, clinical, and humanistic outcomes. But when we think of the last decade, telehealth has definitely become mainstream, especially in the last couple of the years with the COVID-19 pandemic, but it's actually been in use since the 1950s. And I think it's important for researchers and individuals to understand that there's actually 4 different types of telehealth that are used in practice. And these fall within that larger digital health universe that we think of. So the first type of telehealth is synchronous, and that is a live video conferencing normally between a patient and a provider, but it can actually be provider to provider. And that's just in real time. You can see them, you can hear them. The second type of telehealth, though, is asynchronous. And that a lot of times is called store and forward. That's when you're having electronic delivery of documentation. It's in real time, but it's being sent to another provider with the patient information. And then the third type of telehealth, we've seen a huge uptick in this in the pandemic, is remote patient monitoring. And this is when you have a collection of your patient data, it's being shared from one location to another, and it's usually being sent to a healthcare provider to review and monitor a patient's healthcare condition. But then the fourth type, this is when we really start to transition into the digital health universe. This is mobile health. We call it mHealth in the telehealth world, and this is using a smart device or a software application for patient care. So, we've seen a huge emerging shift in state and federal policy changes to remove barriers for telehealth to what would have otherwise prevented the seamless delivery of healthcare, especially during the pandemic. And we know that telehealth was heavily deployed during the COVID-19 public health emergency. It truly accelerated what I like to call a digital health renaissance. And it underscored our lack of telehealth and digital health readiness, especially the tools that we had across healthcare specialties and all of them, as the pandemic really did not allow clinicians or practitioners the ability to preemptively train and prepare for this virtual provision of care when there was this high demand and necessity going on in the world. On the contrary, when we look at telehealth readiness assessment tools, a lot of them, if we look back, they're more than a decade old, and we live in a different world now. So these telehealth readiness tools, they don't account for the current healthcare ecosystem that exists today. And these tools are so important, though. Organizations use them, individuals use them to identify deficiencies that they can improve upon before implementing a telehealth service. So there's a need for them, definitely. And so the challenge that I'm trying to solve is how can we support clinicians and practitioners with a readiness assessment tool that is up to date, that can help them prepare for the provision of virtual care using telehealth or digital health services. And the method that I'm using to do this is I'm really looking at 6 different domains related to readiness. So the first one is the personal education and their qualifications. And I'm really interested in looking at what is their didactic training? Do they have experiential training, professional, maybe on-hand direct patient care experience using telehealth or digital health? The second domain is attitudes and skills. And this goes more into the operational decision-making. This is looking at their stakeholder acceptance of the telehealth or digital health program. It's looking at the individual. Have they done continuous professional development in this area? But it's also looking at the perceived value. Do they believe in the value of telehealth and digital health? And actually, who do they have as a defined member working on their telehealth care team? The third domain that I'm interested in is technology, security, and compliance. We saw a lot of these flexibilities during the COVID-19 pandemic, and we'll continue to see them change as the public health emergency ends. But this is really looking at their access to different platforms. Do they have IT support? Do they have secure servers or HIPAA compliant software to be able to provide virtual care? The fourth domain I'm interested in looking at is workflow, operation, implementation, evaluations. This is like fidelity testing. Do they have their responsibilities outlined? Are they documenting their interventions? Do they know how to address limitations and barriers and overcome them, doing continuous quality improvement? The fifth domain that I'm interested in is regulatory and scope of practice. And I think this will be very interesting to see the changes and the continued trends that we see as the public health emergency comes to an end. But this is drilling down to state-specific restrictions, who is actually a qualified healthcare provider that's able to furnish a telehealth service, who can reimburse for the service logistically, which goes into the sixth domain, which is funding and reimbursement. And that is really looking at the funding resources that they have available to provide the virtual care.
Why have you chosen to pursue this question or problem?
To give some background, my career started at the cusp of a paradigm shift in patient care. When I graduated from pharmacy school, shortly after CMS, the Centers for Medicare and Medicaid Services, they announced a really exciting new initiative. And it was to drive value-based care. It was designed to incentivize providers to focus more on the quality of their service than the quantity. But in addition, I've dedicated my career to pharmacy practice advancement initiatives that have leveraged telehealth and digital health services for these value-based programs. These programs have focused on developing effective interprofessional care models to improve access to care, patient medication safety, their medication adherence, and also the cost savings for patients. Well, while I was practicing as a telehealth pharmacist and as an educator, the World Health Organization announced the COVID-19 public health emergency. The pandemic started. And it was a really interesting time to see what telehealth had not been as common in practice to see overnight, a huge dramatic shift in everyone using telehealth services. And I always like to reflect that what we were able to achieve in the first month or two of the COVID-19 pandemic would have taken decades to achieve if we think about the evolution of technology advancements. When the pandemic was happening, also just knowing through my experience on interprofessional healthcare teams that telehealth definitely had a positive impact on patient quality outcomes. We knew that it helped to identify medication-related problems. We knew it could help with hospital readmissions prior to the pandemic. What we were starting to see during the COVID pandemic is its continued use of telehealth and its ability to help with no-show rates. We saw that it was helping avoid disruptions between our patient-provider relationships. We also saw better patient appointment attendance and also patient adherence to their care plans, coincidentally helping with their chronic disease management. So as a telehealth advocate, it was incredible to observe this dramatic change in the uptake of telehealth. And in my practice, it became clear to me at that time that my patients that had never been exposed to telehealth or digital health, they were simply ill-equipped. But so were our practitioners, because clinicians were left without this ability to deploy virtual care and keep up with a high demand without the ability to train ahead of time for it. If we look back prior to the pandemic, we can see colleges of medicine, about 40% of them were training on telehealth. If we look at colleges of pharmacy, for example, and we think about the CAPE guidelines, these are accreditation standards for colleges of pharmacy. The term telehealth and digital health are not found anywhere in these standards. So there clearly was a gap in training on this communication modality and way of delivering patient care. And if we think about those tools that we referred to, those were more than a decade old, and they were not considering the regulatory changes that were happening. But also, as a telehealth advocate, I also, as a patient, have used telehealth and digital health services, either checking in my kids or their pediatrician or using my telehealth dermatology provider. And I try to always bring my personal experience into my research, really understanding that your patient is the most important member of your healthcare team. And although patient-reported data, it is subjective. As we look at digital health and the user experience, when we think of digital health concepts such as omni-channels, these are going to more and more be heavily relied upon for the successful provision of virtual care.
As individuals and collectively as a society, what can we do to help answer the questions or solve these problems?
There is much work to be done in this area. As individuals, what researchers are looking for is for individual practitioners, clinicians to disseminate their scholarship, publish, present, get the word out there on what you're doing as far as innovative telehealth, digital health programs. And taking that a step farther, clinician researchers are really interested in learning more about your care team structure. What are the roles of the care team members? What are their responsibilities? Do you have a quality assurance process in place? How are you engaging your patients? And overall, what is working and what is not working for your program? But as a society, clinician researchers are looking for the adoption of these telehealth readiness assessment tools, not only to validate them, but we want to receive valuable feedback whether as a focus group or maybe a subject matter expert that's continuously modifying them to adjust to this ever-changing healthcare world that we live in. Although I'd have to say, most importantly, what we can do as individuals and as a society collectively is to be transparent. And we understand as researchers that there's bias and there are confounders that have influences on our publication opportunities. But one of my favorite types of research is pragmatic research. And I love it because it helps us find answers to the questions, what is going to work best? In some ways, it reminds me in clinic. I'm a primary care and care pharmacist, and we have a patient assessment tool. It's 7 questions. So when a patient comes in, if they have a concern or a complaint, you ask them these, and 2 of them are what makes it better and what makes it worse. And much like that, as researchers, it's tremendously valuable to understand what worked and what did not. And it's going to be crucial for transferability. That's why I believe that transparency through comprehensive pragmatic research that's really including these operational decisions, this will be key to helping us better understand advanced preparedness for the virtual provision of care.